And of course, you welcome back. This is the pulse brought to you by Defend Drill, and of course, your comments welcome. I will soon share with you the comments that your comments on the matters we've discussed so far. But let's talk about a very important matter now, and it's about the health of you. Now, the Ministry of Health is this very afternoon engaging striking nurses and midwives to find a lasting solution to the impasse. There's been chaotic scenes in public health facilities across the country as the nurses' strike enters a critical phase with a total withdrawal of services. Now, patients are stranded, clinics overcrowded, and doctors overwhelmed. Now, despite the court injunction, the nurses and midwives insist they won't return until their collective bargaining agreement is implemented. And this they committed to in July 2024. Something government says must first be reviewed. We are keeping our tabs on that meeting between the Ministry of Health and the striking nurses and midwives for updates. But first, let's go on the ground here in Accra. And my colleague Collins Frimpong visited some facilities in Accra and reports that industrial action continues to bite hard, with the elderly and babies, being the hardest hits. And he spoke to some of them.
We've been to 3 health facilities in the Greater Accra region, including the Adabraka Polyclinic and also the Greater Accra Regional Hospital, known as RIDGE. Here is the Kolebu Teaching Hospital, where we are trying to assess the impacts of the strike by the Ghana Registered Nurses and the Midwives Association. And one thing is synonymous with these 3 health facilities. That is, patients are stranded within these facilities. Nurses, there are no nurses around to attend to them. At the Adabraka Polyclinic, we engaged the medical superintendent at the facility, that's Dr. Abdul Razak Kwao, and he gave us details of what is really happening within the facility. He told us that the facility is currently short with nurses because on average they need about 40 nurses to operate on a particular shift. But currently they are relying on just about 5 nurses who are not part of the strike that is ongoing. And also they have made calls that they are looking at 3 nursing assistants to also come in to support them. At the Greater Accra Regional Hospital, also compared to last week where patients were not getting any access to health care, this morning the situation was quite different. Management of the facility have been able to put measures in place where doctors are now playing dual roles now. While they are looking at playing their own or doing their own work, they are also looking at playing the functions or doing the functions of the nurses and the midwives. We engaged some of the patients there, and they also told us the issues that they are facing, and they pleaded with government to ensure that all that the nurses required are also provided.
Me de me brother na ba e bedu a 5:30. Be si sa time yen hwe. No mo se nurses for cause strike. Inti doctors for ne ba be hwe so mo ward nso still mo ma nipa bebre kra ba yo mo ko. Inti esra ban se ne nurses for hia no nya mo na ye ba o matimi ahwe ye. Ese nipa nkwa ho hia.
Na de wo ha na mo de ba
Me nua ne ye call cardio na ye me ekotwa na koma. Inti oni ne de ba ye.
Ene na yesenka mo ba nanka.
Ese se be hu doctor no. And they buy so up to now, that's what you.
And that's the baby. Right. So that's the situation here, a sad moment. So she came here with her brother who had issues, a surgery around the heart. That today they are supposed to see the doctor to review the situation, but they are not getting anybody to assist them.
I pay member last month, and I almost share me say member on the 9th. I didn't see me buy.
Na idea putting out the buy.
Makumaso, I say Yarebe Makumaso. Until me buy. Until me be who Akuma doctor. Until me buy and I almost say one young buy and train. Until you go sweet train.
How many minutes? I'm not doing saying already.
I know, and your dream may be as a sea in a room. A sea in a room. See who next for no say. International doctor no nyamba o baba and ntina buy
say bia wonya nurses and as doctors amon man show wo baby a wo ko
ni baby a me ko just me coffee but the last month and me yare me yofu mum na me ya nti ma be bibia wie say o me surgery ɛna doctor say yare bi dem akoma so ise omo cure yare na ansa na my surgery no ɛno na aka na me ba up and down since last month me ba up and down Sunday we ɛna omo frame say member on the knife ɛna ya bedura ya tete ho na omo say doctor nyam bae no
ano pa ka me ba review amba ya so nurse for call strike ntino this me di ma ho me kakra ma sori akofi
na how be reporting na what by review no there na nka oba be
me operation me kon operation tika sabre me review ma me ba review amba last week almost say was strike this week is almost strike say me enim da omo beba eno na me pese me hwe nya me de but say me ba review na doctor hu say me okay bamba ya just me san kofi
your name penny for doctors hospital managers na chochon kuma won say o mama doctors for no astepi in ejuma esenka nurses for na ye na omo enye no doctors for na e ba be monya ne ntie bisa obi aka be bisa
be da be abranti o yi card o se me kofi
card ni sikofi
so mu ni ho na doctors ni ho nurses ni ho nti o mu ntumi nya adwuma so nurses ni na ebo surgeons no na nurses ni ho so aji me kofi.
At the Kolebu Teaching Hospital, the situation wasn't different from this what we witnessed from the other facilities, but here there was a scene at the emergency ward based on the information that we've picked on the ground, where nurses, the senior nurses somehow clashed with the junior nurses because the senior nurses were trying to provide treatment, health care to patients that were already on admission. But the junior nurses won't allow that to happen. But the authorities also came in to ensure that the issue was resolved. And the information that we had is that at this particular moment, the facility is not admitting any patients again, but those that are already on admission, those that they've already been here for some time now, they are trying to provide treatment to them, healthcare for them so that they can be discharged in the meantime. Also, when we got here, we also saw about 10 police officials over here that the information based on our interaction with them, what they told us was that they are here to assess the impact of the strike.
All right, so let's check what is happening outside the shores of Accra. Let's head to the Upper West region where Rafiq Salam has been doing some checks and the impact so far. So Rafiq, welcome. So is the situation different from last week? Right, if Rafiq can unmute for me so we can hear you. It looks like we are having connection issues with Rafiq Salam. We'll see if we can rectify. So, Rafiq, if you can hear me, last week and today, Monday, is the situation any different? Well, but Rafiq has been speaking to the deputy chair of the health committee in Parliament. If that video is ready, we can bring that on while we bring in Rafiq. So listen to Rafiq's interaction with the Vice Chair of the Health Committee of Parliament, Mr. Sandari.
Oh, it's biting. Even if one nurse or one midwife doesn't go to work, it affects health service delivery because there will be a vacuum created. And you can see the number of health facilities we have in the Upper West region, from the regional hospital to district hospitals, to health centers, to chiefs compounds. So it's really a very serious situations. You know, some patients have told me about their stories of going to the health facilities, you know, and, you know, how they expected service to run fast is not what they expected. There might be some nurses holding the fort, but the skill mix would not be the same. I mean, they may be using other staff that would not have the same qualities or the same skills as those who are striking. So it's really a serious issue. Like I said, we just have to find a solution to it.
Right, so that's the Vice Chair of the Health Committee in Parliament, Dr. Sebastian Sandari. Rafiq Salam. So Rafiq, is the situation any different from what you reported last week? Well, we don't have Rafik, so let me move to the central region where Abigail itself in Nkrumah is on the ground for us. So Abigail, is it the same like we are reporting Accra in other parts of the country in the central region? So Abigail, if you can unmute for me and tell me what the situation is in the central region. Well, we were not getting her attention. Abigail, if you can hear me, what is the situation in the central region?
All right, so today we went to the Cape Coast Teaching Hall to observe the happenings during the strike. Upon entering the hospital, you may assume the strike is not in session or is not effective, but it is. We saw some members of the Union of Professional Nurses and Midwives Ghana, assistant doctors, as well as rotational nurses moving around assisting patients and doctors in the hospital. We spoke to some patients who had come to seek services for maternal issues. So we had two patients who had just undergone cesarean section last week, and they tell me that since they came to the hospital that morning or this morning, no one has attended to them. Usually when they come, you find nurses there attending to them, checking their vitals before they go to see the doctor. But for today, they've been sitting there for hours and no nurse has attended to them. And when they ask, they say the nurses are on strike and they don't have adequate staff to attend to them. So they are just stranded and they are pleading, joining the call to government to heed to the demands of the nurses so they can come back to work, help the patients and deliver quality health care.
Right. So we can listen to some of them, those you interacted with when you went there this morning.
About 1 week, remember review. Why I'm serious? My doctor Shemukun, nurses will be on your house. Overcheck him vitals, my doctors. Everybody will be hours work or strike. My woman country is so in train. Mahadi. To had my brand, I also coffee. Baby, I have a review. Be ampunesses behind. I yes, I band them or your bay in Onyana. Yam so ya by washing.
Back for review. The operation last week. But and then by be a nurses be near around. If you say almost strike. The one woman been me approaching or catch me say main train a doctor bana na kono ho. They say it's why air train. Say doctor be around now. Edi ya 7 opportunity. So first na your bounce anka nurses for no midwife for more around. No more check your vitals koha. But na your buy a higher door. Obi abe transia no bla no so coffee. I say if you was at the or if a grandpa back in and out 70 cedi. Minimum means to buy 140. It's a 140 a bear make cut better than a massage or back. The extra buying. The nurse is named midwife for what they are to buy any my own young. I buy on Momodiana on track in the show. I am say about how much me I share. We are 30 and 30. All the way from to be as in your
Right, so that is the situation in the central region, not different from what we are experiencing here in the Greater Accra, in the Upper West region, but is it any different from what is pertaining in the Ashanti Regional Capital, Kumasi? Clinton Yeboah has been visiting the Confederate Teaching Hospital, the South Hospital, and the Pampaso Children's Hospital. Clinton, what can you report?
Well, out here in the Ashanti region, the situation seems to be the same. However, a certain twist when you get to Confanoche is that unlike last week where patients were trooping in, but then they met nurses who would then tell them that they are on strike. This time around, they are coming to meet empty wards and empty units. So even at the Konfanochi Teaching Hospital, when you get to the emergency unit, where it's a very busy area, very crowded area, that daily you would find people there. The place was empty, with beds empty. And what I find also very intriguing was that the beds were being moved out. When I inquired about why the beds were being moved out, they told me that they are trying to put on a small cleanup since the place is not in use. But then when you step out and you engage some of the patients who have come to seek healthcare, what they tell me is that some of them were booked for appointments with their doctors today. When they came, the only thing the doctors could do was prescribe them medicine that could take them weeks. That is to say that they are somehow compromising on, the medication, just so they do not know when the strike would be called off. So they are compromising effective medication that could take patients weeks and months. Apart from that, also for people who have already been admitted at the hospital are now being prematurely discharged, and so you meet someone who is not so fit, but then has been discharged to go home and given a prescription to go for. They complain so much that why were they not informed, especially those who were given appointments, why were they not informed before they were let into the hospital just to be informed later? And now they are stranded at the hospital, they are paid their medical bills, and they show the bills to me, asking why they would go through all the processes. The essential one, that is to get the correct care from nurses, they do not get.
And does it in any way suggest the fact that, last week, the striking group said they will be withdrawing total services this week, which means that those even on admission will be asked to go home. Do you get a sense that it's already taking effect?
Yes, it's taking effect because the leadership that I engaged last week on this particular issue, this week, were not in the hospital. When I called and I asked them that I wanted to have a conversation with them, they told me they are not coming to the hospital. And the nurses that I met at the hospital are not in nurse uniforms. They have actually taken down their uniforms and wearing cardigans. And so what they tell me is that they will not put on the uniform just so people even approach them to seek for their help.
Right.
So they will just put on home attire.
And then finally, Clinton, I mean, there are some nurses who are not really in favor of the decision taken by the Nurse and Midwives Association. For them, they want to continue to extend health service to those who may be in need. Did you come across any group of people working in the midst of this strike?
Unfortunately, no. I don't know, fortunately or unfortunately, no, at the Konfanochi Teaching Hospital. They seem to be in unison with respect to the decision that has been taken by their leadership.
All right. Clinton Yaba, thank you so much from the Ashanti Regional Capital, Kumasi. And then soon, I'll take you back to the region, but this time to Mampong, where final funeral rites are underway for the late manhenning of the Mampong traditional area, that's where Osebun. So I mean, if you like, the vice who until he's the vice president of the Ashanti Kingdom. But Ivy Setoji is in the voter region. Ivy, is the situation any better?
Not really. The situation is not any better. At the whole teaching hospital earlier today, a few of the nurses were in their uniforms, but we were told that there were rotational nurses. We don't know what that meant, but that was when we were told that there were rotational nurses, and some of the nurses were also, some people have been called, professional workers have been called to help at the hospital. Right. So that the persons will not be neglected. And so most of the hospitals we went to, we couldn't find the nurses. Most of them are not working. Even those who were there were not in uniforms, according to some people we spoke with. At the municipal hospital in Ho, we were not allowed to go in because, according to them, they will have to get clearance before journalists were allowed in. So for now, the situation is not different from the voter within other districts. So we have similar situation where a few nurses were there as rotational workers, whilst the others are not working. Patients are suffering, patients are asking for the authorities to do something about the strike, to pay them according to them so they can be able to attend to them, because some of them have emergencies to be attended to. Some have operations, or they need to be operated on, and they don't have nurses to help. And so they are asking government to do something about the situation so that the nurses can get back to work.
Ivy, thank you so much. And of course, the rotational nurses are the ones who have just come out of school and they are being given practical experience. So they are moved from hospital to hospital. That's why they are called rotational nurses. Rafiq Salam, if you can hear me for the third time, tell me what is happening in your region.
This one, it will be better.
Oh, of course, it's better.
Okay, Alton, the situation in the Upper West region is not really different from what we are hearing from the rest of the country. Currently, I am at the War Municipal Hospital, and I can report to you that there is a total shutdown.
Total shutdown.
Of what? Healthcare, total shutdown at the OPD, outpatient department, and also at the emergency ward. And I can report to you that as for the emergency ward, it's under lock and key. The nurses have decided the place is almost look like a ghost town, and then the patients, inpatients, are not in there. And also, currently at the OPD, I can tell you that there's only one patient who came around, and there's only one nurse who is a member of the UP. And
we are losing you, Rafiq, if you can perhaps. Yes.
It's the one thing that there's almost nobody is there. The seats are really empty here, and there's nothing at OPD. When you go to the maternity ward, there are skeletons of staff right at that particular place. And so at the War Municipal Hospital, I can report to you that emergency services and the OPD services are completely closed down.
So now that the emergency ward is closed, those who were there receiving medical care, where are they now? Have they been asked to go home?
I'm told that they were asked, that they were told that the strike is no more, the strike is on, and so because of that, they will not be able to attend to them, and so they left the emergency ward, and so maybe probably they will be at other private health facilities in town, and also the situation here, the hospital more or less look like a ghost town, and somewhere along the line, I saw goats and sheep. They have really taken over. Probably, I thought that they also came for medical care, but they were also jumping around the walls and a whole lot of things. So currently, I'm just close to the emergency ward, and you can see clearly that it's locked. You can see that it can't open. This is where I am in now. And then these are the other wards. Few patients right here. There are the pharmacy services, and then very few people also around that particular facility. And so the situation in this particular hospital, the War Municipal Hospital, is currently partly shut down, emergency services and OPD services. But when you go to the regional hospital, somehow it's better. Though the numbers there are really overwhelming, doctors there, some of the doctors who are really on leave have been called, has been asked to cut short their leave and then come to work. That is the situation at the regional hospital, where doctors there are now doing dual roles. They are now doing the work of the nurses and also doing their own. And so the situation there is somehow better, but doctors have been called, has been asked to cut short their leave and then come to work.
So Rafiq, finally, so this facility where you are reporting from, so where are the doctors? Where are the administrators? Have they also left their posts? What is happening in terms of keeping those who are not on strike to work?
The management of the hospital, I'm told that they are at their offices, but I can spot a couple of doctors also at the consulting room, but the nurses are nowhere to be found.
All right. Let's leave it here for now. Rafiq Salam, thank you so much for that report from the Upper West Regional Capital, WAB. Dr. Mark Nawame is the chairman of the Health Committee. Doctor, I mean, you heard what Rafiq told us just some few seconds ago, painting a picture of an abandonment, if you like, from this facility where he's reporting from. The emergency center has been closed, the OPD closed under lock and key, and hospital staff have virtually left the facility. Is the health committee taking an interest in this matter with the hope of resolving it?
Let me say good evening. Hello?
Yes, doctor, I can hear you. Doctor,
let me say good evening to the viewers of News, television, and say that, yes, we should expect it. You know, nurses are the backbone of the healthcare system. In fact, health sovereignty, quality, and resilience depend on them. And when they are not there, practically there's a standstill in all departments in the hospital. As a health committee, we have not actually been approached formally to assist them in this negotiations, but actually we want to be part of the solution, and that is why we are saying that the nurses did not complete all avenues for negotiations. Hello, can you hear me?
Yes, I can hear you. Dr. We can hear you. Please go on.
You can hear me?
Yes, please.
For negotiations. Okay. We hope that this problem will be resolved as fast as possible, or else without invitation, the second arm of government, I mean Parliament, represented by the Health Committee, would have to invite all the parties to Parliament for a thorough discussion about the issue. Indeed, the Health Committee is meeting tomorrow to discuss what steps we'll take. But I'm hoping that even before we do that, we are calling on the nurses, you know, on humanitarian grounds, to call off their strike, get back to the negotiating table, and talk to the executive arm of government. I'm saying this because I understand that a tripartite committee was formed to look into the issues and find a solution to it or to implement it. The tripartite committee involved the Ministry of Health, the Ministry of Finance, and then the leadership of the Nurses Association. They've had some meetings already, but I think the last one, which was called around 22nd of May, they did not go because possibly they have lost trust. But we want to assure them that
yes, Dr. Nawani?
Should have confidence. We speak now. I understand there is a meeting going on.
Yes, there is.
Between the minister and then the nurses, and possibly the leadership of the nurses. And I'm hoping that they will come out with a solution. I've looked through the conditions of service that they put forward, and majority of them are very good suggestions. Majority of them are things that even some time ago used to exist. I don't know why, whether it disappeared or not, somewhere along the line. For example, fuel for some category of nurses.
Yes, 100.
You know, I've been practicing for 32 years. Yes, and so this thing used to be there. I used to take fuel allowance when I was in government service, and it used to be there for the matrons and other senior staffs. And so, you know, it's nothing new. Uniform allowance, the government is paying 400 Ghana cedis. And if they now 1,000 Ghana cedis, inflation has taken place. And once inflation over the years, you know, have taken place, I believe that probably this figure needs to be reviewed. So it is about the figures. Look at this one too. Royal incentive.
Yeah, the rural posting incentives.
Yes, for the rural workers or those who are posted to the rural areas. It's good. I'm from the rural area. We are always lacking staff. If there could be incentives given to the nurses that accept postings to those areas, then probably we might have more staff. But if you look at
there's also the 13-month salary.
Very good. The 13th-month salary. During our budget hearing in Parliament this year, the teaching hospitals and the regional hospitals came over because the facilities were taxed to be paying this 13th-month salary.
Right.
Remember that the 13th-month salary was an allowance that was given to them during the COVID pandemic. And when COVID ended and in the transitional period, they asked the facilities to pay. Indeed, some of the facilities tried to pay, but when they came for budget hearing, they all complained that, in fact, they couldn't do that.
Right.
And I've seen that that is not part of their condition of services. And I'm saying that that is why we need to sit down and talk, because from May last year, when they negotiated, I believe that the situation has changed. And so if the Ministry of Health is calling for them to sit down and jaw or negotiate on some issues, probably some of these things needs to be negotiated properly, because we have to understand, in Ghana, when one sector starts and you don't take steps to contain it, there's always a ripple effect.
Right.
And for example, the 13th month which we are paying to health workers, what about when the electricity company workers also demand for it? What about the water company? They are all providing essential services. What about the police who protect us in the night and day? What about the military that fights to keep the nation going? If all of them come to demand what we call a 13th month salary, what will be the effect on the reset agenda of President Mahama? So we need to negotiate. There's the need for us to sit down and talk.
All right, we'll leave it here for another one. The meeting is still ongoing, so hopefully the two parties. Last week, the Minister of Health demanded the involvement of a third party who will be neutral and then decide what must be done. But as we've been told, this meeting is under the auspices of the Ministry of Health with the striking nurses and midwives, and it's ongoing. That's why we are unable to bring them on this show today. But hopefully, when this meeting is over, we'll have it. Now, the nurses and midwives, among others, are demanding a 13th month salary with some kind of allowance, and this will be paid by the facility that they are working with. There's also 180 liters of fuel per month. They are demanding for category of some senior at a certain level. They are demanding 1,000 Ghana cedis for clothing allowance, 1,000 Ghana cedis annually. They also demand allowance for accepting postings to rural areas. These, among others, are the demands. And this was signed off in July for implementation, July 2024, and almost a year on, it remains unimplemented. The reason why they say that until their demands are met, they will not return to the hospitals to work. But the Director General of the Ghana Health Service, Professor Samuel Kaba, has appealed to the nurses to consider the plight of the patients and return to the negotiation table.
Let me also take the opportunity to call on our sisters and brother nurses to come back to work. Just like yesterday, I said to one nurse that if you come to the hospital now, you as a nurse, and you are pregnant, you are going to deliver, because she was a pregnant nurse. What are you going to say? Will you say, I won't deliver today because we are on strike? You'll be shouting, let's all do this. Let's go back to the negotiation table. If it's your auntie, your mother who is sick, what are you going to do? Will you say, I won't take her to the hospital because we are on strike? And when you go to the hospital, who do you expect to take care of your mom or you yourself? So I humbly add my voice to the Honorable Minister that please come back to work and let's continue negotiating.
Well, so we are keeping an eye on this ongoing meeting between the Ministry of Health and the striking nurses and midwives. When that meeting is over, we'll bring you the latest on this matter. But let me take you to the court now, because MPP sympathizer Theophilus Thompson, who allegedly assaulted Joy News journalist Lateef Idris, has been denied bail by the circuit court and will reappear in court on 18 June after pleading not guilty to assault and threat of life. 55-year-old Theophilus was captured on video along with the other suspects who are currently on the run, assaulting Lateef Idris during the live coverage of the detention of the MPP Ashanti Regional Chair, Bernard Nchibu, also known as Emmanuel Ntibem, in Yoko custody. He pleaded not guilty to accounts of assault and threat of life. My colleague, Kenneth Jesse, sat through the court proceedings today and came to with this report.
Well, after several minutes of court deliberation, the accused person, 55-year-old Theophilus Thompson, has been refused bail, although that is not what his lawyer would have wished for him. His lawyer argued in court that his client was not a flight risk and had a permanent place of abode and should therefore have been granted bail. But the state prosecutor also argued that if he was granted bail, he could tamper with the current ongoing investigation. They also did indicate that since some of the suspects are at large, it will not be best to grant him bail. Well, counsel for the accused also pleaded with the court to temper justice with mercy and urged the court not to punish his client by refusing him bail. So hearing the pleas of both sides, the presiding judge decided not to grant him bail and remanded him into custody to reappear before the court on the 18th of June 2025. Well, there are still others who are at large, and the police say they are continuing their manhunt for them. Bigwigs of the New Patriotic Party, including Nana B, who is the national organizer, and also Salam Mustafa, who is the deputy general secretary of the party, all showed up in court to support Theophilus Thompson. The 18th of June is ticking, and we will definitely be here to bring you more. From the Circuit Court, my name is Kenneth Jesse for Joy News.